Hi everyone, this is Dr. Ty Vincent. This video is not really about LDI, low dose immunotherapy. This video is about mycotoxin illness, more in general, which is not an immunological illness, as far as we know so far. I should say I made a mycotoxin LDI mixture several years ago. I've tried it in many people. It's never worked for anyone so far. So far, theoretically, I guess it's possible that somebody might have an immune reaction to mycotoxins that could explain their chronic symptoms and strange things they're dealing with. I have not as yet been able to validate that theory, that have not run into somebody that has that. So mycotoxin illness currently in my thought process is not an immunological illness. It is a direct toxicity problem. And I want to go through this because I get lots of patients who at some point in their health journey or illness journey have been told that mold may be part of their problem, or, which is very common nowadays because there are a lot of doctors kind of building a whole practice around treating mold related illness. I've had a large number of patients who are told adamantly that mold is the cause of their illness. And frankly, in the vast majority of these cases, it's not. And I want to go through that because many of you have been driven absolutely mad by the concept that mold is making you sick. And then when you start looking into it, it's everywhere. Like mold is literally anywhere you can live, mold can live better. Okay. So it's going to be around you. It's going to get in your mouth every single day through the air that we breathe, the things that we drink, the foods that we eat. Some foods are actually very high in molds and mycotoxins. And so when people have this belief, like a lot of these doctors have this firm belief that people are being made ill by mold, you start looking for it and it's in you. You know, you do tests that show it's in you. It's everywhere. It's in your house. And it makes people very fearful. And they do very extreme things to try to eliminate it from their life and exposure or their body. And then they don't get any better. So like in a general sense, if you've done all the things to try to avoid mold exposure and eliminate mycotoxins from your body and you have not improved, then that is not your problem, okay? And I want to go through for people some of the realistic thoughts about this process, realistic interpretations of the tests that are available, how to sort of properly try to figure out if this is your problem or not and what to do about it. One of the other things I've run into a lot lately is when I ask patients how they were told to try to reduce the mycotoxins in their body, they were given the wrong advice. They were given very poor, ineffective advice about how to do binders. 9 times out of 10, in fact, in the last few years, the patients that I've asked, well, what did the doctor have you do for your protocol? It's an ineffective protocol. And so that's not good either. I don't know where the disconnect is between many of the practitioners in the mold world and reality, but it's getting worse, not better. So anyway, like I said, a lot of people, most people who think they have a mold related illness really don't seem to. And again, I'm talking about mold toxicity. So these are conditions where you have had some sort of identifiable large exposure to a toxic mold, like either in your home or your workplace or your school. Generally, it's got to be somewhere you spend a fair amount of time. If you just went into a barn for a couple of hours and were around it, that's not enough to get mycotoxicity, okay? This is a kind of condition where you accumulate the toxins over time. It isn't usually going to make you sick right away. It requires a certain duration of exposure. And most of the other people who are in the same environment with you will also be sick. So if you are the only one who's sick in your home and everybody else lives there too, and in fact, maybe you're the one who works for a living and you go elsewhere and come back, and you find that there's mold in your house, the people who spend more time, the person who stays at home all day, if they're not sick, then it's probably not that problem, which is nuanced, you know, so we'll get into that a little bit. So that's one thing to think about. The other thing is the symptoms you're experiencing should stay with you wherever you go, because the problem would be a toxic buildup within your body. So it will not be based on exposure or situation, which is the opposite of mold allergy. So I treat mold allergy with low dose immunotherapy very effectively, but in that case, people feel fine if they are not in a moldy environment, but if they go into a place where there's mold, then they usually quickly develop symptoms of some kind of, allergy symptoms. For some people, it's delayed the next day, which makes it hard to sort out. But for most people, they'll start to have symptoms. And then when they get away from the mold exposure, the symptoms go away. That's a very different pattern of symptomatology. So it's pretty easy to tell, well, this is a toxicity thing and that's an allergy thing. And then, of course, to further confuse people, you can have both. So you can have mycotoxicity and mold allergy. But with the mold allergy part, you will only have symptoms upon exposure. And then when you get away, the symptoms ease up. So sort that through. If you're looking for a good place for mold exposure to test that theory, thrift stores usually create an opportunity for abundant indoor mold exposures. That's my favorite test place for people. If you can go to a thrift store and walk around for an hour and you don't feel sick, then you're not allergic to mold. Not indoor molds, at least. So let's talk about mycotoxins. Mycotoxins are everywhere in the environment. Like I mentioned earlier, they're in the air you breathe, the food that you eat. Many foods that we eat are very high in concentration of this, like certain fruits. They're very high levels of mycotoxins. Dried cherries, I think, is one of the top, or cherries themselves. So if you eat something yesterday, if you eat something today that is fairly high in mycotoxins, then if you get a urine test tomorrow, you should have high levels of mycotoxins in your urine, right? That would mean that you're getting rid of them. And that's what's called normal existence, normal life on Earth. If you have mycotoxins in your urine, that's normal because they're in the air, they're everywhere. So one of my pet peeves is a lot of the physicians doing this test, they go, oh, look, you have high levels of mycotoxins. That means you have mycotoxicity. It does not mean that at all. It could mean entirely the opposite. If your body is really good at clearing and eliminating mycotoxins, then you should piss out lots of mycotoxins the day after you're exposed. And that doesn't mean you're ill because of it. One of the problems with a urine test is that it's looking at what your body is eliminating. And that does not in any way reflect what's still in your body. Like on garbage day, you may have a huge mountain of trash outside on your sidewalk in front of your house. Does that mean that you have a bunch of trash in your house? No, it's the total opposite. You just cleaned out your house. So the doctors who are telling you you have toxicity because of a urine test, that is totally contrary to logic and reason and science, and it's super annoying to me. If you get those HLA tests done, so many of the doctors are also telling you, oh, well, the problem is you don't adequately eliminate mycotoxins, but they're basing that in most cases on a urine test. Well, your urine test is still high, and you have these bad HLA genes. I don't know how you can tell a person you have trouble eliminating mycotoxins, and I know that because I measured them in your urine, which is proof that you do in fact eliminate mycotoxins. So I don't understand that, but that's what is told to most of the patients that I work with. They were told those two things at the same time. And it's an absolute logical impossibility that those two things are both true. So get past that. The HLA markers have absolutely nothing to do with mold or mycotoxins or how you handle them. Human leukocyte antigens are just random proteins on the surface of white blood cells. White blood cells don't play any role in this process. White blood cells don't play any role in detoxification of chemicals or metals. So what proteins you have stuck on your white blood cells is not relevant to the conversation in any way. They have no function that we've determined, and at best they have very loose associations with certain autoimmune diseases in terms of prevalence. But having an HLA marker does not guarantee that you'll even have one of those autoimmune diseases. The associations are fairly small statistically, even with the best of them. So don't waste your money getting HLA tests done because they mean nothing. Other doctors are also using a whole host of like other blood tests, MMP9 and MSH levels and tissue growth factor beta and C4As. And a lot of these markers, well, let's say all of these markers can mean a number of different things. Not one of them is specific to mold or mold-related illnesses or mycotoxin illness at all. None of them mean that. There are a myriad of possible causes why they might be out of range, high or low. So to tell anyone that this blood tests, list with whatever pattern it shows means that you have mold-related illness is just completely nonsense. You can't draw those conclusions. So this is a complicated diagnosis, right? In my opinion, the way to go about this is if you have symptoms that seem like they could be mycotoxin related, so you're developing weird neurological symptoms, fatigue, brain fog, peripheral numbness, muscle jerks, a lot of the things you'll read lists online, right? You can have weird rashes, you can have burning eyes, you can have respiratory tract symptoms from exposures, but the toxins themselves will mostly give people neurological symptoms, central nervous system, peripheral nervous system. If you're developing those things and other people in the house are also, then your chance of some exposure within the environment being the cause are getting much better, right? If you find toxic mold buildup, then the odds are even better that this is what's going on. You want to try to remediate that and clear it out. And for some people, they clear the mold exposure out, and over the next several months, everybody in the house is better and they're completely well. That's great. If that doesn't happen and you're wondering if you are in fact heavily burdened with the mycotoxins and that's the cause of your illness, the one test that has some value, in my opinion, is a visual contrast sensitivity test, a VCS, which you can do on the internet. You just go online and you look at different lines and see if you can identify them and discriminate them or whatnot. It's pretty straightforward and it's a cheap test. And you can do it without a doctor's order. So you can do a VCS. If you flunk it, then you may have mycotoxin illness. The problem is you may instead have Lyme disease or heavy metals toxicity. There are some other things that'll cause it to be abnormal. So it's not confirmation necessarily that you have mold-related illness. But if you pass the VCS and you do normally on the test, then you almost certainly don't have mycotoxin illness. So that's the major utility of the test, is if it's normal, then you can go, okay, there's something else going on with me. I should look at other possibilities. I don't need to burn my house down and rebuild it out of glass and cement just yet, because that's like some of the advice people get is to burn everything you own, start over. Anything you build, anywhere you go, any new things you acquire are going to have mold and mycotoxins too. So just, pump the brakes on that whole thing. If you then, you fail the VCS, you have exposure, you have symptoms, so it sounds more and more likely that mycotoxin illness is your deal, then go on some kind of effective binder protocol. And if you take an effective GI mycotoxin binder protocol, within a month, you should really be noticing some improvement. By 3 months, you should see really dramatic improvement. And most people are done with this by 3 to 6 months. The caveat there is you need to have eliminated the exposure. So if you haven't been able to eliminate the exposure in your house and you're just doing binders, you're kind of treading water for a while. So you're not going to necessarily get complete resolution of your problem if you still have the exposure, obviously. So, evaluate those things logically. But if you get out of the exposure and you can't identify any exposure and you take effective binder strategies for several months, generally you're done. And this shouldn't cause any lingering long-term problem. If you do that, and you continue to have the same symptoms, then something else is going on. You don't need to continue the binders for a year. You don't need to do the VIP nasal spray. You don't have to take any antifungals up your nose to clear it out, because mold does not colonize human beings until you're dead. Okay, that's another one of the beliefs out there, is that, well, maybe you have mold like colonizing you and growing in you, and it's producing toxins in you. That would only happen if you were dead. Okay, a living human being, your immune system will not allow mold to just grow in you. If they do swabs of your nasal passages and things like that, you'll find it, sure, because every time you sniff, you get pollen and lint and dust mites, all whatever's in the air, you'll find in somebody's nose. That doesn't mean that it's living there. That doesn't mean that it has created an infestation in you. You're alive. You have a functioning immune system. You're not on life support in the ICU and about to die. Those are the people that start to get fungal colonization. So that's not a thing, all right? Anyway. Let's talk about how to do proper mycotoxin clearance, because that's about the only thing I have left. It baffles me, the people that are getting horrible advice about this. The way to think about it is that mycotoxins enter your body through your mouth, your nose, your respiratory tract, or your GI tract. You're getting them in sort of all the time. They absorb into the bloodstream, they circulate through. The primary routes of exit are your kidneys, right? So your kidneys filter a lot of things out, and that's why you can measure them in your urine. And that's just going to happen passively. You're going to passively eliminate a certain rate of mycotoxins over time, which is why most people, if they just get rid of the mold exposure, they will gradually improve and regain their health. The other route is through the GI tract. And what happens is your liver filters them out, and then your liver dumps them into your biliary tract. So it goes through into the gallbladder and then out through the common bile duct into the intestinal tract. But then it has about 25 feet of intestine within which it can reabsorb into the bloodstream, and a lot of it does. So The problem with that enterohepatic recirculation, we say, is that it had an opportunity to leave the building, but it came back into the bloodstream because it absorbs. Mycotoxins are very small and they absorb into the bloodstream like nutrients. So we have various items people can use as binders. So GI binders are substances that do not absorb into your body. That's important to understand. They bind things within the gut, so the mycotoxins attach to them, and then they stay in the stool. They don't reabsorb into the bloodstream, and they get carried out in the feces, and they're out of your body. That's the goal. It's important to understand that they don't absorb into the body, because some people have this, concept in their head that I'm going to take these mold things and it's going to go around my body and find the mycotoxins and then somehow pull it out through I don't know what orifice. That's not how that works. That's not at all how that works, and it's not a possibility. So in order to do this effectively, you have to match the passage of the binder substance through your gut along with the travel of the mycotoxins through your gut. And the mycotoxins are kind of trickling through in your bile all day long with sort of boluses of bile whenever you eat. If you eat something fatty, your gallbladder dumps a whole bunch of bile at once. So, you could take binders with a fatty meal and maybe you bind them up and absorb them, but you want the binder substance to trickle through your gut for long periods of time during the day, just like the mycotoxins are. So it's matching, right? What I'm hearing people are getting as protocols from their practitioners are capsules. So most people say, well, they tell me to take a couple of like charcoal capsules once a day or twice a day, but you're just swallowing a capsule. You're not matching that passage at all. The charcoal doesn't sit there in the third part of the duodenum going, come here, come here, come here. I'm going to catch all the mycotoxins that come out for the next 4 hours. No, it just passes through. So whatever mycotoxins happen to be in your intestine right there with the capsules, those will get bound up really well and pass out in the stool. But the other 21 and a half hours of the day, you're not doing anything. So the way to effectively do this is to get some kind of powder form of your binder, whether it's bentonite clay or charcoal or cholestyramine, and mix it in with a liquid, like a liter or more of some kind of juice, something that you don't mind sipping on, and mix it in there and then just sip on it slowly over a long period of time. And if you mix a couple of these a day and just sip on this all day long, or, a couple hours in the morning, a couple hours in the evening, it's something you just sip. So the binder is passing through your intestinal tract sort of similarly to how the mycotoxins are passing through. And you want to do it at least a couple times a day. You just kind of make it part of your routine. It doesn't have to be complicated. It's not some aggressive thing. You can't do it aggressively. It's a gradual thing. You have a little bit coming out every day. You match it with the binders. You bind it up. A lot of the binders will also bind various vitamins and minerals and nutrients. So this isn't the kind of thing you want to do just all the time forever as some kind of health promoting practice, because it has a downside of malabsorption of nutrients. But you're doing this with the intent of eliminating these toxins. And like I said, if you're doing this right and you truly do have mycotoxin illness, you should be seeing noteworthy improvements within the first month, and by a few months, major improvements. And like I said, the people where this has actually been their problem and it has been successful, 3 to 6 months, generally people are done. And then if this doesn't work for you and you have persistent symptoms, they don't improve at all within a few months of doing this binder protocol, then you need some help figuring out what really is wrong with you, and it's not mold related. So I'm available to help people with those sorts of things. I have a lot of experience with this. There are a lot of other good integrative doctors out there in the country that are good with this sort of thing too. But if you do this stuff on your own at home, because you don't need a doctor for any of the things I just explained to you. You don't need the testing. The testing is a complete waste of time and money. It will just freak you out and drive you nuts because everybody's going to have positive tests. Just go through this process the way I outlined it. Find out on your own whether mycotoxin illness is your thing. If it is, you can fix it on your own. You don't need a doctor, like I just laid out. If that doesn't fix you, then you may need somebody with some expertise to try to help you sort out what really is going on with me. I have a lot of experience with these kinds of problems.